Hello, my name is Ravi Gandhi. I'm a board-certified neurosurgeon. I subspecialize in cerebrovascular diseases, brain tumors, and skull-based neurosurgery. Today, I'd like to talk to you about brain tumors. There are many different types of brain tumors. Brain tumors can be divided into two different categories. The first kind is primary brain tumors, which are tumors that grow from a type of cell within the brain itself. The other type of tumor is a metastatic tumor, or a tumor that has come from somewhere else in the body, from a type of cancer that has grown somewhere else in the body and then found a way into the brain, either through the bloodstream or through a direct extension. The most common symptoms of a brain tumor are headaches or a neurologic deficit. Those neurologic deficits could be in the form of weakness, numbness, things that may come across as a stroke. Other symptoms could be a seizure. Oftentimes, brain tumors are diagnosed on accident or incidentally. One of the most common questions that I have heard after somebody has been diagnosed with a brain tumor is, why did this happen to me? Some brain tumors are, unfortunately, unrelated to any patient-related factors. Other tumors, such as metastatic tumors, can happen as a result of certain lifestyle choices, such as smoking. And other tumors may happen as a result of a genetic condition. Most brain tumors are not related to patient-specific factors. They are just findings that happen and are unrelated to anything that you or your loved one may have done. Regardless of the type of brain tumor that you may have been diagnosed with, there are always lots of options for treatment. It is important to take into consideration specific factors related to your tumor and to yourself, such as age, size of the tumor, location, or the expected tumor subtype. When a tumor has been diagnosed and a treatment option is chosen, it is very important to take into consideration the patient specifically and what your wishes may be. Some of those options include radiation, surgery, or observation. Observation comes in the form of getting periodic CAT scans or MRIs on an annual or biannual basis. Surgery can be a minimally invasive surgery or sometimes an open surgery in order to remove the entire tumor. Sometimes surgery can be in the form of just doing a percutaneous or minimally invasive biopsy. Some tumors can be taken out through a very small incision or with no incision at all through the nose, or using something called an endoscope, which is a small camera to help visualize the tumor. Other tumors can be treated with a type of technology called a laser interstitial thermal therapy, which is a type of fiber optic laser cable that is put into the tumor to basically heat up the tumor and cause the tumor cells to necrose or to die. That can help to treat those types of tumors. Because we have so many options for treating tumors, it is very important to meet with a specialist who specializes in all the different options for treating brain tumors. So one of the most common questions I get asked is, what could I have done to prevent getting this type of brain tumor? There are lots of different types of tumors, and a large majority of them are unrelated to patient-specific habits. One of the most common things that patients do that can help to reduce the risk of a brain tumor is quitting smoking. This is something I'm very passionate about, and any of my patients who I have discussed smoking cessation with can tell you that I am very adamant that this is an important step in treatment. Oftentimes when I meet a patient who has been diagnosed with a brain tumor, I will involve an entire team. I work in a multi-specialty group that would include a radiation oncologist, an oncologist who specializes specifically in brain tumors called a neuro-oncologist, to help with the diagnosis and treatment of each patient. We meet weekly to discuss cases in order to get a consensus about what the next best step in treatment is. If you have been diagnosed with a brain tumor, or somebody you know has been diagnosed with a brain tumor, it is important to see somebody or a neurosurgeon who specializes specifically in brain tumors. There are always new technologies coming out that help to facilitate treating brain tumors, whether these include medications such as chemotherapy, radiation, or different surgical technologies.